I was always wondering when this day would come. The days of Terminator have finally arrived. I'm Nick Hansen, and we're going to get to the point on robotically assisted surgery. Surgeons are pretty accurate, but what if we could get even more precise with using robots? Well, Dr. Gibbons is currently performing a procedure using a robot to perform an implant procedure. I'm gonna go join up with him right now, and we're gonna go watch the procedure, and then I'm going to talk with him after the procedure's over.
Today for our case, we're gonna be doing full arch on the upper, and we're gonna be utilizing the robot to help us do guided implant surgery. We have pre-planned the case already, and so the benefit of the robot is it allows us to be able to place those implants precisely.
5, 6, 7, 8.
All right, that's good.
Okay, you're in pre.
Go to 8.
6, 7, 8, 9, 10, 11. Add depth.
Okay, now we're gonna go
You're in
to
pre.
11.
You're on 11. Guided. Tilt towards the chin. Locked in. 5, 6, 7, 8, 9, 10, 11.
That's good.
All right. Pre.
By 27.
7. Good. 8. Going up on torque. You're at 50. 10. 11. Going up on torque again. You're at 60.
Perfect.
Add depth.
Done with the implants.
All right, so we're completing case.
Do we clap? I've talked about how we just brought robots into oral surgery. So tell me a little bit about why we would use robots in oral surgery.
So we're using the robot in our practice to be able to do guided implant surgery. What does that mean? So we can take a 3D scan of our patients and be able to virtually treatment plan exactly where we want these implants to be placed. And then utilizing that treatment plan, we can put it in the software, and then the robot helps us to place those implants precisely where we have planned them.
Cool. So you just did one today.
Yes.
And I did another video on FP1. So tell me a little bit about why it was so beneficial for doing I called it full arch implant bridge or FP1. So tell me why it was so beneficial.
In certain treatments, where we place an implant, we have some leeway into where that implant gets placed. And so the day of the surgery, when we're performing the surgery, we try to find the best place at that time. But for a treatment like the FP1, where it's imperative that we place those implants very precisely for the outcome of the treatment, this is a tool in our arsenal that helps us to do that. So guided implant surgery is not a new phenomenon. However, robotic guided surgery is a new phenomenon. So one of the benefits to using this system is that as we are going through the case, sometimes we decide we want to place an implant a little bit differently. Maybe a little bit deeper, maybe a different size, depending on what we find once we're in the surgery. And so with traditional guided surgery, using a static guide that would fit over the teeth and needs to be pre-planned for a specific implant, if you change the plan as you're working, well then all of a sudden you're not doing guided surgery anymore. But with the robotic system, all we have to do is go into the software, adjust it on the software, and then boom, we're back to doing guided surgery.
I've always said you want a oral surgeon or periodontist to be the one performing a surgery. Now we got a robot performing the surgery, but explain why. And I got to witness it in the surgery that just happened, and you guys had to make a on-the-fly adjustment and change out what your plan originally was. So tell me why you would want a specialist like an oral surgeon or periodontist to still be performing with the robot.
So you're still doing surgery, and so it's imperative that from the surgical side and from the prosthodontic side, you have somebody with experience doing the surgery, doing the prosthetics. So the robot is just a tool in our arsenal, but it's still up to the surgeon and the prosthodontist to deliver the best treatment for the patient. And so you can program this to do something incorrectly, and it will help you precisely do it incorrectly. So again, it still takes the expertise of somebody who's done a lot of implant surgery, done a lot of prosthodontics, to be able to deliver the proper outcome.
So a lot of people have never heard of oral surgery robots, but most people have heard of the Da Vinci robot.
Mm-hmm.
And if I remember correctly, this kind of spun off from the Da Vinci robot. So if you could talk a little bit about like how it's similar to a Da Vinci robot but different.
Well, all robotics, and it's really becoming common in abdominal and pelvic surgery, orthopedic surgery. You go to any hospital, they're going to have, or surgery center, they're going to have, a robotics unit, it seems like. So again, what this is it allows, a well-trained surgeon, an extra tool to be able to deliver the best possible treatment for the patient. So, again, if you don't have any expertise, don't have any experience in placing implants in this case, or doing orthopedic surgery or doing abdominal surgery, you're not going to move just to doing a robotic surgery. There's a lot of learning and a lot of detail that goes on in your point where you can get up to be using a system like this and be able to do it proficiently.
So it was pretty neat to watch. So you guys had planned the case ahead of time, and Dr. Rodriguez had made teeth to be able to match up where you were going to place those implants. And then you had to have a guide so that the robot knew, I guess it was using some coordinates somehow to figure out where the patient was, because our patients aren't intubated, they're moving.
Yeah.
So talk a little bit about how the robot adjusts for the movement of a patient.
We're able to take a cone beam CT scan, a 3D scan that the patient may have previously had, and do the treatment plan on that scan. But then the day of the surgery, we need to register the patient and the robot together so that the robot knows exactly where the patient is. So how we do that is we place a fixed splint onto the patient, either onto their teeth or onto the upper jaw. And then we take a new cone beam scan with the patient with that splint in place, and a special device called a fiducial array, which just screws onto the splint. The robot is able to then register the patient based on that fiducial array once we connect the patient to the robot. And so the robotic software then has the ability to merge the treatment plan from the old CBCT or the old 3D scan with the new one that was taken. So then now we have our previously made treatment plan superimposed on the existing patient's 3D scan, and then the robot knows exactly where we are. And so before we get started, we do some checks, some positioning checks, so that we can identify that the robot is indeed registering, the correct position of the patient. But then once, like you were saying with patient movement, even though the patients are sedated, they still will be moving a little bit, or we may be moving the patient as we're working the patient's head. So that robot has the ability to track the patient then. So as the patient is moving, the handpiece that's attached to the arm here moves along with the patient, so that then again, if there's a slight movement or deviation in the patient, the robot's going to accommodate for it. So we're still going to be doing guided surgery. Now that is opposed to other systems which do navigation. What navigation is, kind of like guided surgery, but again, the surgeon is still 100% in control of that system. And so if the patient moves, if the doctor's hand moves just a little bit or gets just a little off angle, there's nothing to prevent that from happening. In this case, once you're in guided mode, you're in guided mode.
So the navigation's just telling you, like navigation software is just telling you, here's what you did, not here's where you need to be.
Yeah, it's just another tool to help you place an implant, but it is not guided implant surgery. Because this is the navigation.
Because this is actually your hands on there, but the machine's actually moving to the right spot.
Yes, once we're in guided, so I'm still in control as the surgeon, but it will not let me deviate from the plan. I can only go to a certain depth, and I can't move my hand. I can't, translationally move. I have to stay in the same position. So I'm still in control, but I'm 100% guided.
So 100% every time you're going to get right in the right spot with the width of the bone. You're not going to be taking out any buccal bone, which is the front of the bone, or missing it at any angle.
Well, and you know, the most important aspect is we want to do restoratively driven or prosthetically driven treatment. So we want to plan where we want the patient's teeth and then work our way backwards to where the implants need to go. A lot of times implants just get placed and then, okay, put the teeth on there, wherever those implants may end up. But with this, with our awesome prosthodontic team, we are able to treatment plan the final outcome we want and then figure out exactly where we need those implants to be placed so that we can deliver that treatment for the patient. And it also helps us in complex cases. If we know we can plan all this out and now we know, oh, we're going to need to bone graft this site because we need more bone to get this implant placed in the proper position, or you know, we're going to have to do a sinus graft, or
which you did one of those today. I saw with the robot. So explain that.
So the robot allows us to do indirect sinus lift, so we can drill up just to the floor of the sinus using another technology, Versa densification burrs, and then be able to bump the sinus floor up in a very controlled fashion. So again, I can go up step by step, millimeter by millimeter, to bump up the floor of the sinus and gain us some extra height when we need it.
What I was watching during the surgery was you had somebody on one side, so you have a computer, which is a laptop, and then you had your screen. So you were able to see what was going on real time, and then you had somebody else that was controlling what you were telling them to do. I think just kind of explain what you were doing.
Yeah, well, so the robot needs inputs and you know, somebody to tell it what exactly we're doing in the process. So as we're going along, we need to tell the robot which tooth position we're working at. So again, the implants and whatnot have all been pre-programmed, but we need to then, you know, tell the robot what we're doing. There's a difference between a free mode where I'm moving the arm into position and then going into guided mode, difference between drilling and placement of the implant. So yes, we have somebody who's always in charge behind the scenes who's just making sure the robot is at each next step that we're doing.
It was pretty neat to be able to watch the robotically assisted procedure today from start to finish. And it made me feel more comfortable with the robot, and I hope it made you feel more comfortable with the robot. And we're not in Terminator Doomsday. The robot didn't take over. The surgeon had complete control the whole time. And even during the procedure, they had a plan, and they had to make an adjustment during the surgery on the size of the implant and what they wanted. And they were able to easily pivot and make that adjustment within just a matter of a minute and move on with the procedure as planned. But I'm Nick Hansen. Today we got to the point on robotically assisted oral surgery.